Multiple sclerosis, MS, is a chronic autoimmune disease that affects the central nervous system. It occurs when the immune system mistakenly attacks the protective covering of nerve fibers, called myelin, causing communication problems between the brain and the rest of the body. The symptoms of MS can vary widely from person to person, but some of the most common ones include fatigue. Fatigue is one of the most prevalent symptoms of MS, affecting around 80% of individuals with the condition. It can range from mild to debilitating, making it difficult to carry out daily activities. Motor and coordination problems. MS can cause muscle weakness, tremors, coordination difficulties, and problems with balance and walking. These symptoms can significantly impact an individual's mobility and independence. Sensory disturbances. MS can lead to abnormal sensations such as numbness, tingling, or burning in different parts of the body. These sensory disturbances can be intermittent or persistent, affecting daily functioning and quality of life. Cognitive impairment. Many individuals with MS experience difficulties with memory, attention, information processing, and problem solving. These cognitive impairments can impact work, relationships, and overall functioning. Pain. MS-related pain can manifest as headaches, facial pain, muscle pain, or musculoskeletal pain. It can be chronic or intermittent, affecting the individual's comfort and well-being. Understanding the common symptoms of MS is crucial in managing the condition effectively. Medications play a vital role in alleviating these symptoms and improving the quality of life for individuals with MS. Importance of medication in managing MS symptoms. Medications are an essential component of MS management. They help reduce inflammation, slow down the progression of the disease, and alleviate specific symptoms. There are two main types of medications used in MS management: disease-modifying therapies, DMTs, and symptom-specific medications. DMTs are designed to modify the course of the disease by reducing relapses, delaying disability progression, and minimizing brain and spinal cord damage. These medications target the underlying immune system dysfunction that drives the inflammation and myelin damage in MS. DMTs have been shown to be highly effective in reducing relapse rates and slowing disease progression. In addition to DMTs, symptom-specific medications are used to manage individual symptoms such as fatigue, pain, spasticity, and bladder dysfunction. These medications target specific symptoms and can greatly improve an individual's quality of life. It is important to note that MS management is highly individualized, and the choice of medication depends on various factors such as the type and severity of MS, the individual's overall health, and their treatment goals. Consulting with a healthcare professional specializing in MS is essential in determining the most appropriate medication regimen for each individual. Now, let's explore the top 5 medications that have shown significant efficacy in treating MS symptoms. Interferon beta. Interferon beta is a widely used disease-modifying therapy for MS. It is available in different formulations, including subcutaneous injections and intramuscular injections. Interferon beta works by modulating the immune system, reducing inflammation, and preventing relapses. Clinical trials have shown that interferon beta can significantly reduce the frequency and severity of relapses in individuals with relapsing remitting MS. It also helps slow down the progression of disability and reduces the number of new brain lesions seen on MRI scans. Common side effects of interferon beta include flu-like symptoms, injection site reactions, and liver function abnormalities. These side effects are usually mild and temporary. Regular monitoring of blood counts and liver function is necessary while on interferon beta treatment. It is important to discuss the potential benefits and risks of interferon beta with a healthcare professional to determine if it is the right choice for managing MS symptoms. Fingolimod. Fingolimod is an oral medication that belongs to a class of drugs known as sphingosine 1-phosphate receptor modulators. It works by trapping certain white blood cells in the lymph nodes, preventing them from entering the central nervous system and causing inflammation. Fingolimod has been shown to be effective in reducing relapse rates and slowing down disability progression in individuals with relapsing forms of MS. It also reduces the number of new brain lesions seen on MRI scans. However, fingolimod carries some potential risks and side effects. It can cause a decrease in heart rate, so individuals starting fingolimod treatment need to be monitored for at least 6 hours after the first dose. Other common side effects include headache, flu-like symptoms, diarrhea, and liver function abnormalities. Like all medications, fingolimod may not be suitable for everyone. Consulting with a healthcare professional is essential to determine if fingolimod is the right choice for managing MS symptoms. Natalizumab. Natalizumab is a monoclonal antibody that targets certain immune cells involved in the inflammation process in MS. It is administered through intravenous infusion once every 4 weeks. Natalizumab has been shown to be highly effective in reducing relapse rates, delaying disability progression, and reducing new brain lesions seen on MRI scans. It is particularly effective in individuals with highly active relapsing forms of MS. However, natalizumab carries a risk of a rare but serious side effect called progressive multifocal leukoencephalopathy, PML. PML is a viral infection of the brain that can be life-threatening. Regular monitoring and assessment of the individual's risk of developing PML are necessary while on natalizumab treatment. Due to the potential risks associated with natalizumab, it is usually reserved for individuals who have not responded to or cannot tolerate other MS medications. Dimethyl fumarate. Dimethyl fumarate is an oral medication that works by activating a cellular pathway called the nuclear factor, erythroid-derived 2, like 2, NRF2, pathway. This pathway helps reduce oxidative stress and inflammation in the central nervous system. Clinical trials have shown that dimethyl fumarate can significantly reduce relapse rates and slow down disability progression in individuals with relapsing forms of MS. It also reduces the number of new brain lesions seen on MRI scans. Common side effects of dimethyl fumarate include flushing, gastrointestinal symptoms such as diarrhea and nausea, and lowered white blood cell counts. These side effects are usually mild and temporary. As with any medication, it is important to discuss the potential benefits and risks of dimethyl fumarate with a healthcare professional to determine if it is the right choice for managing MS symptoms. Ocrelizumab. Ocrelizumab is a monoclonal antibody that targets a specific protein on immune cells called CD20. It is administered through intravenous infusion twice a year. Ocrelizumab is approved for the treatment of both relapsing forms of MS and primary progressive MS, making it the first medication to be approved for the latter. Clinical trials have shown that ocrelizumab can significantly reduce relapse rates, slow down disability progression, and reduce the number of new brain lesions seen on MRI scans in individuals with both forms of MS. Common side effects of ocrelizumab include infusion-related reactions, upper respiratory tract infections, and lowered white blood cell counts. Regular monitoring and assessment of the individual's risk of developing infections are necessary while on ocrelizumab treatment. Discussing the potential benefits and risks of ocrelizumab with a healthcare professional is crucial to determine if it is the right choice for managing MS symptoms. Conclusion and additional resources. Managing MS symptoms is a multifaceted process that requires a comprehensive treatment approach. Medications play a crucial role in alleviating symptoms, reducing relapses, and slowing down disability progression. The top 5 medications discussed in this video, including interferon beta, fingolimod, natalizumab, dimethyl fumarate, and ocrelizumab, have shown significant efficacy in managing MS symptoms. It is important to note that medication choices should be made in consultation with a healthcare professional specializing in MS. Each individual's treatment plan should be tailored to their specific needs, goals, and overall health. In addition to medication, lifestyle modifications such as regular exercise, a healthy diet, stress management, and adequate rest can also contribute to the overall management of MS symptoms. Support groups, counseling, and alternative therapies such as acupuncture or yoga may also be beneficial for some individuals. Remember, managing MS is a journey, and finding the right combination of medications and lifestyle strategies may take time. With the right treatment plan and support, individuals with MS can regain control of their lives and experience improved quality of life.